Oxymorphone is a potent opioid analgesic used for pain management. Its pharmacology involves several key aspects. 1. Mechanism of action. Oxymorphone acts primarily as a mu-opioid receptor agonist. It binds to these receptors in the central nervous system, producing analgesia, pain relief, and other opioid effects. 2. Analgesic effects. Oxymorphone is more potent than morphine and has a rapid onset of action. It can be used to manage moderate to severe pain, such as post-surgical pain or cancer-related pain. 3. Pharmacokinetics. The drug can be administered orally, intravenously, or through other routes. It undergoes extensive first-pass metabolism in the liver and has a relatively short half-life. 4. Metabolism. Oxymorphone is metabolized mainly in the liver, primarily via glucuronidation. The main metabolite is oxymorphone 3-glucuronide, which is inactive. Oxymorphone is available in different forms, including immediate-release and extended-release formulations typically. For the immediate-release tablets, the starting dose for adult patients without previous opioid tolerance is around 5 mg to 10 mg. Every 4 to 6 hours is needed for pain. For the extended-release form, e.g. Opanor, which is used for chronic pain management, the initial dose is usually lower, such as 5 mg to 10 mg once every 12 hours. Oxymorphone, like other opioid medications, can have several common side effects. These side effects can vary in intensity from person to person, and not everyone will experience them. Common side effects of oxymorphone may include 1. Dizziness or lightheadedness. Many people may feel dizzy or lightheaded, especially when standing up from a sitting or lying position. 2. Sedation or drowsiness. Oxymorphone can cause significant drowsiness, making it important to avoid activities that require mental alertness, such as driving, while taking the medication. 3. Constipation. Opioid medications, including oxymorphone, often lead to constipation. Stool softeners or laxatives may be necessary to manage this side effect. 4. Nausea and vomiting. Some individuals may experience nausea and, occasionally, vomiting when taking oxymorphone. 5. Itching, itchiness, or skin rash can occur as a side effect in some patients. 6. Dry mouth. Oxymorphone can cause a dry or cotton mouth sensation. 7. Respiratory depression. In high doses or when misused, oxymorphone can depress respiratory function, which can be life-threatening. 8. Tolerance and dependence. Over time, some patients may develop tolerance to the analgesic effects of oxymorphone, requiring higher doses for the same pain relief. Additionally, physical dependence can occur with prolonged use, leading to withdrawal symptoms if the medication is abruptly stopped. 9. Potential for addiction. Oxymorphone has a high potential for abuse and addiction, and patients with a history of substance abuse are at higher risk. Oxymorphone can interact with various medications, and it's important to inform your healthcare provider about all the drugs you are taking, including prescription, over-the-counter, and herbal supplements. Common drug interactions with oxymorphone include 1. Central nervous system CNS depressants. Combining oxymorphone with other medications or substances that depress the central nervous system, such as benzodiazepines, sedative hypnotics, or alcohol, can increase the risk of respiratory depression, sedation, and overdose. This combination should be avoided or closely monitored by a healthcare provider. 2. Monoamine oxidase inhibitors, MAOs. Concomitant use of oxymorphone and MAOs can lead to severe reactions, including hypertensive crises. MAOs are a class of antidepressant medications, and caution should be exercised if switching from or to an MAOI. 3. Serotonergic medications. Combining oxymorphone with serotonergic medications like SSRIs or SNRIs can increase the risk of serotonin syndrome, a potentially life-threatening condition characterized by symptoms like agitation, hallucinations, rapid heart rate, and high body temperature. 4. Anticholinergic medications. The concurrent use of oxymorphone with anticholinergic drugs, which include some antihistamines, tricyclic antidepressants, and antipsychotic medications, can lead to increased constipation and other side effects. 5. Antidiarrheal medications. Combining oxymorphone with medications like loperamide Imodium or diphenoxylate atropine low-modal can increase the risk of severe constipation. 6. CYP3A4 inhibitors. Medications that inhibit the enzyme CYP3A4 can potentially increase the levels of oxymorphone in the body, leading to a higher risk of opioid-related side effects. Some examples of CYP3A4 inhibitors include certain antifungal medications and some HIV protease inhibitors. 7. CYP3A4 inducers. Drugs that induce CYP3A4 may decrease the effectiveness of oxymorphone by increasing its metabolism and reducing its analgesic effects. Examples of CYP3A4 inducers include rifampin and some anticonvulsant medications. 8. Naltrexone. Combining oxymorphone with naltrexone or naltrexone-containing medications can precipitate opioid withdrawal symptoms due to naltrexone's opioid receptor blocking effects.